Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Anthrax. Anthrax is caused by Bacillus anthracis, which is a zoonotic infection. Anthrax is seen in patients who handle the livestock. Clinical features of anthrax include involvement of malignant pustule. This malignant pustule is not painful. Malignant pustule is most commonly seen on hands, neck, and face. This malignant pustule is presence of small pus-filled cavity or pustule which is present on an erythematous base. When this pustule ruptures, it results in formation of a crust along with surrounding erythema and edema. The surrounding erythema and edema may sometimes give rise to superficial vesicles. Treatment of anthrax is usage of antibiotics like oral ciprofloxacin, doxycycline, and amoxicillin.
thank you and thank you for watching.